Yeah.
Hi, my name is Emma. I'm going to be doing my intramuscular injections testout today. So first I'm just going to show you all the injection sites on the patients and then that are possible and what is common and what's not. And then I will go and drop my medication and then enter the patient's room like I normally would. So for the first injection site, can I have you sit up please? So for the first injection site, I would have deltoid. I would make sure the patient's relaxed and then relaxed again to prevent pain during the injection. So you find her bony prominence right here, and you measure about 2 to 3 fingers down, and then right where that is, you can I have you flex please? And you can feel the muscle right here, and that's where you would inject for the deltoid. Could I have you lay facing me please? So while the patient's facing me, I would use, this is her right hip. So I would have my left hand finding the trochanter right here, and I would have my pointer finger touch the top of the anterior superior iliac spine and my pointer finger pointing towards the crest. And then right in the center of the V, where it forms here, I can feel the top of the bone right here and the crest right about here. There's a little muscle site right here. Could I be flexed, please? And when she flexes here, you can feel it. And then we have the rectus femoris, which is right here. So you find the patella right here, and then you'd find the bottom of the pubic bone here. And then right where your middle fingers line up, it would be right about in the center of that. Could you flex, please? And you can feel the muscle right here when she flexes. And then you have the lateris femoris right here. So you have your fingers at 90 degrees for the rectus femoris, and 90 degrees. And then for the lateris, you have your fingers at 45 degrees, and that's most commonly used on infants. Could you flex, please? And you can feel the muscle right there. So that's where that one would be. So we have 1, 2, 3, and 4 for the dorsal gluteal. And now I will go set up my medications to go into the patient's room. So I'll be injecting this medication into the deltoid because it's only a 0.5, according to the doctor's order, it's only 0.5 milliliters of Florax quadrivalent. I have the patient's chart here. Haley has 12/21/01. So prior to entering the patient's room, I'm going to cleanse my bile for 15 seconds. I perform hand hygiene prior to this. Cleanse the vial for 15 seconds. And then I will open my syringe. And I have a 1-inch 3 milliliter syringe. We'll uncap it. I will draw back 0.5 milliliters of air. Then I will inject it into the vial. Sorry. And I will draw back that 0.5 milliliters. Okay. I'm gonna flick to just get the last of those bubbles out. All right. Recap the needle. And then you can see here, I'm just gonna flip it to make sure you can see. It's 0.5 milliliters and there's no air bubbles in it. All right. So prior to entering the patient's room, I checked the MAR with the medication. We have 0.5 milliliters, Florax quadrivalent, and that's what this is. You check according to the right patient, right medication, right time, right dose, right route and right documentation. So now I'll enter the patient's room. Okay, I'm just gonna enter the patient's room and then come back to do the skill. Knock, knock.
Hi.
Hi, my name's Emma. I'm gonna be your nurse today. I'm just gonna ask you a couple questions. So today we have your flu shot. Does that sound right?
Yep.
All right. Do you have any allergies or anything like that you know of?
Nope.
All right. Perfect. So I'm just gonna wash my hands and grab the needle, and then we'll do your injection. Okay?
Okay.
Perfect. So can I just get your name and date of birth again?
Haley has 12/21/01.
Okay, perfect. So that would be my second check. And then my third check would be at bedside with the wristband. So I'll do hand hygiene. I'll put on my gloves. I will clean the patient's skin for 30 seconds in a circular motion from inner to out. Do that third check. Make sure the patient's arm is relaxed, and then have them relax again so that there's no tension, so it kind of decreases the pain. Uncap that needle, pull the skin taut, make sure I measure down the 2 to 3 fingers. And then I'm just going to use a darting motion and inject slow and steady. Remove, cap my needle, apply pressure with a bandage or a pad if they're bleeding, which they're not, so there's no need. And then I would just let the patient know that any muscle pain for 1 to 2 days is pretty common, but to call the doctor if they have any rashes or anything like that.